So embracing equity to me means to understand that women have needs, different needs based on their social, cultural, political, economic backgrounds, and to accommodate all their needs. For example, embracing equity to me at home means to understand and cherish the difference between my son and my daughter, and to provide resources, opportunities for them to grow in their own way. And in the same way, embracing equity to me at work means embracing the diversity that all the men and the women bring at the workplace culture.
Embracing equity in a workplace requires an all-of-organisation approach. It's not a women's only issue. There are women who are born today who do not have the same access to education and voting, as well as having to overcome other barriers as well to reaching their full potential. So embracing equity is so important and adds value to our workplace.
So to me, embracing gender equity means being willing to have those really open and often tricky discussions around the gender dynamics and how they can impact in a situation. And I think it's really important to actively embrace that, because differences of opinion and different people bringing different perspectives to the table can often lead to better outcomes both in healthcare and beyond.
Well, we want to make sure that as we go forward that we are including diverse members of our community in research, and that our therapies are going to be effective for all members of our community, both from both genders as well as different racial groups, and also that we are investing in research that is for important health conditions, including those that may only impact on women, such as traditionally endometriosis was a women's obviously only condition that was poorly understood and poorly researched, and yet has had a significantly negative impact on many women's lives.
GB Health now has a 4-year Gender Equality Action Plan. We're really excited about how it sets out for us a 4-year agenda in this space. And it really is about us working together to ensure that our systems, our service delivery, our processes, our procedures all reflect our diverse environments, and consider differences and any potential biases that might exist unconsciously, to make sure that we're just working through those, looking at them and making any changes to what we do.
Having a diverse workforce that reflects our community is really important, and there's a very strong link with our CREATE values. So particularly in the context of respect and compassion, I think is really a strong link between our community and the number of women that live locally in our region, but also the number of women that GV Health employs. And I think it's really essential that we keep in mind our values when we're providing care and treatment and services for women across all of GV Health's areas.